I'm Julia McCarthy.
I'm Debra Holmgren.
I'm Nydia Carver.
And we're in St. Paul, Minneapolis, and we're all part of the Portico HealthNet team. Portico is a wonderful program that assists people in finding coverage for healthcare services. And we find people who have no insurance and have low incomes and are otherwise cut out of access options.
I'm the outreach manager at Portico. And when we say outreach, mostly that means going out into the community and finding people who need our services. So most of them have no insurance right now, or they're about to lose their health insurance, or they don't know where to start. So that's where our staff screen them, talk to them about what their options are, discuss things like household size, employment, income, factors that help us figure out if they're eligible for any of the state programs. And if they are, then we help through all the paperwork, because most of the people that we talk to are actually eligible, they just don't know how to get through the system.
I'm a care manager for Portico. I've been there 5 years. And once the family enrolls in our program, then I take them, help them manage the services, clinics, healthcare. And also, it is not that simple than just health, but once you get involved with the family, they have other issues. And so I help them whenever I can, filling out forms, applying for other services. Once I can help them apply also with the county and the state, and I serve as a mediator actually, because the requirements for the state or the county are different, and every family is different needs, different issues. So I help them with all that, working with them and the county workers or state workers.
Well, we're not an insurance plan, and even though we look like one, we're not. We don't ever take risk like an insurance plan does. We're backed by our hospital partners who actually pay for the cost of the services. They give us an annual commitment, and when we pay for Susie to have a strep test, then we bill back to our hospitals and it gets paid. Just before I came to Portico, I was self-employed, so I'd become very much aware of how vulnerable you are to not getting health insurance if you don't have a real legitimate employer. So that kind of heightened my awareness. But in general, I think it's just not fair that people who are hardworking and trying their best to make a living and support their families, kind of by the luck of the draw, depending on where you end up putting your energy. For some people you get access to the whole shooting match, and others you get access to zero without paying for it all yourself. And what I liked about these people I talked to when I ran into them 15 years ago is that there was really a feeling and a belief that, yeah, maybe there would be national health insurance. And this was right during the time that President Clinton was elected, and Hillary Clinton came to Minneapolis to speak, and we were all very excited about it. So many people said this problem will be taken care of. And we said that doesn't really deter our efforts or enthusiasm right now, because it's going to take a while before they figure this out. And we'll just be here until it's time to go away. And so far, it hasn't been time to go away.
And I think we're continually impressed, especially with families who get by on, one adult working for $9 an hour and 2 kids, and they are really resourceful and really make it work. So I think the more we see people, the greater respect we have, and for those with limited resources and how well they really do in our society. The more you do the work, the more you identify with the people that we're seeing. So we deal with people who are from Africa, from Latin America, from Asia, people from the United States. They all seem more and more like you the more you talk about them. They all have the same kinds of concerns. They're worried about their family. They want to have a nice home. They want to have a good job. And they want to be able to see a doctor when they get sick. And it doesn't seem like too much to ask.
30-something-year-old woman who was a taxi cab driver on the north side of St. Paul, and she had never been insured. Had self-employed as a taxi driver, had whatever job she'd had supporting herself in her adult life did not include insurance. And she was one of the people that said, you know, if you start this program, I'm going to be the first one to sign up. And she was about the third person to sign up. Her name was Annie. We got her on the program, and she continues to be an inspiration for me because 15 years later, if we're having a bad day or having if we're having any kind of challenge or struggle, I think about Annie and how enthusiastic she was about the program. She took our brochures out with her when she gave cab rides to people in the neighborhood, and she would pass them out and say, you should know about this program. And the downside of it, which is also partly the challenge to us, is that once Annie got in to see physicians, it turned out she had a somewhat advanced breast cancer, and she died within a couple of years. But we keep her photo around, and we keep her memory around to continue to inspire us.
It's just facilitating and going through the system with them. There's a great need for that, especially for people who don't speak the language, who are not used to this enormous system. It's very complex. And the paperwork and the requirements and every single little piece of paper is got to be there, and it's got to be perfect. It is a nightmare, actually, in some occasions. So when one case gets approved easily, it is a reason for joy. Yeah. It is like you breathe easily, you know. Other cases are on and on and on and on. When I started in Portico, it was everything that I didn't want to do. In terms of everyday thing, you know, being on the phone or talking to people or calling people and all that. I said, what am I doing here? And then when I learned all the process, and I was one-to-one with people, and I was actually helping people so much and seeing how grateful they are. It just touched bases with my own I want to say soul, because that's all I can think of. It brought happiness to me and a sense of accomplishment, that I can be of help to some people. I see the need is so great.
I guess, you know, I would rather spend 12 hours doing something I believed in than 1 hour doing something that I don't, that I'm not invested in. And the payback, the rewards, the fulfillment that comes from working with a program like Portico are so overwhelming compared to what you can get in a paycheck that it just seems natural.
I think for me it's, you know, I'm sure we could all be out selling office supplies or soap or something, but at the end of the week or the end of the year, if you think back, what have I really done? What kind of impact have I really made in the community? That's where this kind of work is important. And it is health, but health also leads to so many other things. So healthy kids are going to be in school, they're going to succeed. You know, healthy parents are going to be able to take care of their kids. So it's about more than just their medical care, it's really about their lives as a whole.
I think it's a great reason to come to work every day, and you know, there's over 300,000 people in Minnesota that are uninsured still, and right now we cover, you know, we have about 1,500 on our program, and we help another 3,000 get enrolled, but it's kind of the Starfish Theory. We aren't able to help 330,000 yet, but for the people that we do help, it means everything in their lives.